Hello, welcome to Curiosity episode. I am Dr. Shibu Vijayan. I'm the Chief Medical Officer of Qure.ai. Pediatric tuberculosis is a global challenge. So, annually around 1.2 million pediatric TB cases are estimated to be notified. However, it is only somewhere around half or 50% of it is notified. Last November, WHO has released the Global Plan to End TB, third edition of it, which also calls out some of the new approaches, including classifying pediatric tuberculosis as severe and non-severe, and also newer diagnostic modalities in the pediatric TB cases. We have seen an uptick in pediatric notification compared to pre-COVID era last year. So there are some, so it's not completely bleak in the pediatric TB domain. There is movement happening. There is a strong impetus and push to find more kids and put them on treatment is happening. So today we are going to discuss the challenges and opportunities and learnings from an expert, none other than Dr. Shailaja Mane, who is the head of the Department of Pediatrics at D.V. Patil, Pune. Dr. Shailaja Mane has a teaching experience of more than 30 years, published more than 68 articles, and she also won the Best Teacher Award. Welcome, ma'am, to the Curiosity with Qure. We are eagerly would want to hear your learnings. Yeah. So, as I just mentioned in my introduction, you might have heard about the challenges in the pediatric TB. So, what are the unique challenges in diagnosing TB? And one of the reason has been cited in the literature is that one of the challenges in pediatric TB is the access to the correct skill set, right? Because we don't have the experts like you present everywhere. So, what are your learnings, and how do you define the challenges in diagnosing TB, pediatric TB, compared to adults?
Yeah, actually, pediatric tuberculosis is really unique, because children are not small adults. So
Correct.
Is true with tuberculosis as well. Because tuberculosis in children is most of the times paucibacillary. That means number of bacilli are less. But since they are having less immunity, the effect is more actually.
There is a mention of it because pediatric TB is still a challenge to diagnosis. Like we would want learnings from the adult TB, especially on AI and chest X-ray, to be replicated in the pediatric domain as well. So,
yes.
What are your thoughts on that? Like when you think about can we pivot on X-ray as for a clinical decision support system? Plus, I know that I completely understand the clinical part of it because we have to be an expert domain there. How can an AI-enabled clinical decision support for a pediatric can change this existing scenario or help doctors in a big way?
I'm very optimistic about use of AI in entire healthcare, in fact, and particularly for in childhood tuberculosis. And India is a diverse country, so where there are facilities in metros and in peripheries, there are very poor facilities, in fact. And even in hilly areas, recently I visited in one of the state of our country where hilly area where even capital was not having the same kind of facility which we are having in our metros. So there are a lot of challenges, and affordability is another issue, and awareness. Affordability and awareness, these are the two main important issues. So as AI is having very positive impact in all other aspects of healthcare as well, particularly diagnostic and therapeutic as well. So is true with tuberculosis in children. So it will be such software which will be helpful to improve the diagnosis and catch early at the periphery, point of care, where we say POC, point of care, particularly peripheral Anganwadi workers, ayas, dayas, where the AI can utilize the many numbers of X-rays and try to diagnose at least doubt, which is at least can create a doubt that this and this X-ray is probably having tuberculosis. Then they can be referred further for the physician consultation, and further things can be done. Because artificial network, this AI will have hundreds and thousands of deep layers, and we can train our peripheral health workers, where chest X-ray can be taken from on the mobile app as well, and they can go ahead and do the screening. And I have heard that in many developed countries as well, there is a AI app which is there on the airports, where the screening, when we raise our hands, that screening of chest is also, entire body is done in fact. So if they are at doubt that patients are deported or cached hold there only, and they are managed, treated as well. So it will be definitely a game changing tool, and it will positively impact early diagnosis and of course then early management as well.
Correct. So, I mean, I think specifically on the X-ray, so there has been the pediatric TB regimen has now classified for severe and non-severe. I know that it is yet to be scaled up, or uptake is still not that optimal. In conjunction with that, Union and WHO has released the Diagnostic Chest X-ray Atlas 2022, 2022, which actually explained
beautiful Atlas. Beautiful.
So, I mean, I think so. What are your thoughts on that? Because like the manufacturers in the AI industry, manufacturers like us would want to convert that Atlas into an AI-enabled tool, right? Okay, so that when an X-ray is scanned by an AI, it should throw up and say, this is a probable case of a severe TB. Then that will, I mean, our thought process that will ease out the doctors who are treating decision making and influence and maybe fast tracking that. What are your thoughts on that? Like, one is like, what are your thoughts on that, whether the Atlas is kind of like looked at all the radiological finding in a critical way to classify, enabling classifying severe and non-severe, and then can AI, when AI automates it, whether that will be of use for pediatricians like you?
Yeah, Shibu, I think that Atlas is amazing, beautiful, excellent classical X-rays are there. But the problem is we are not able to see classical cases always. Whenever till the stage that classical X-ray comes, that is, I think, too late. And as a healthcare worker, I will be happy to catch them early, because WHO guidelines are amazing. They are really beautiful, and they diagnose severe and non-severe tuberculosis depending on both clinical as well as radiological criteria.
We did mention about gastric aspirate and complex clinical approach for that kind of kits, but anything on X-rays which a manufacturer like us think through how AI could help in the younger age group also?
I think we should have enhanced sensitivity X-ray machines or methodology where we can utilize it for particularly the cases which are suspected clinically, at least for them. And it will reduce the need for the microscopic screening as well, because always it is not possible to have evidence microscopically. And another part is it will make quicker diagnosis as well. Because when we send the swab and send the sample, and it will take time, and it will have its own positivity and negativity as well. And so X-ray, particularly X-ray evaluation in cases with HIV infected children, they will have and particularly with atypical radiological manifestations as well, because the opacity of the lungs in the children is different from the, and even bronchoscopy markings are different from the adult one.
I mean, I was saying, so especially in the pediatric, I mean, in the lower age group, when we approach X-ray in adult, the AI is more of a triaging tool for escalating to a confirmatory diagnosis with, let's say, mostly the double molecular diagnosis, right? Whereas in pediatric, it is more of a clinical decision support system. When we talk across to the experts, you clearly also, I mean, alluded to that, ma'am. You said like it's not in an expert like you probably have limited value in having an AI tool, but in the point of care where the patients are seeking care, it might actually could have higher value in helping the diagnosis part. So yeah, that's what I was actually trying to emphasize. So you also know that in that same, when you say clinical decision support system, WHO has come up with a checklist. You might have seen that, which is with different weightage of symptoms. the idea, so it was a union and WHO joint initiative to have that checklist to enable health workers, because it's not about
that is actually patient-centered approach.
Yeah. So enable health workers to get diagnosed through a checklist. X-ray is one part of it. So we as a manufacturer is trying to actually also automate that checklist to power the AI further with additional input from that checklist. So what are your thoughts on that? Because there are two sets of information coming, whether that will ease out some of the decision-making process or challenges what we are now discussed.
Yeah. Actually, WHO had released the guidelines in 2022, where there is emphasis on patient-centered approach, which includes shorter regimen, more effective treatment regimen, integration with newer diagnostic technologies like AI, and prioritization of the vulnerable population. Because in India, we have to adopt these guidelines, no doubt about it, but they can be influenced by various factors, because India is has actually robust TB control program under RNTCP, Revised National Tuberculosis Control Program, and the implementation of WHO guideline is possible, but there are various challenges to it.
Focus on X-ray, active case finding, tiny X-rays coming into, ultra portable X-rays coming into picture. Government of India is also planning to make massive procurement, at least one for every taluk level. There has to be an access to such tiny X-rays which is closer coming to the household. So I'm super hopeful that in the coming days we'll see also a lot of pediatric cases also will be diagnosed through that initiative. You clearly emphasized on the need for continuous evolution of these technologies as we learn more from the field. So it's an iterative process. Like AI is not a one-time tool. Like it will change. There are a lot of complex kind of presentation also. Like we also need to adapt. The machine need to adapt. Evolved in putting up IT solutions. Especially we came up with a laptop which was having a high battery life, and also we can actually install our software in that we don't need a Wi-Fi for it. So it also work off. So that kind of learning came from this experience. So it's a continuous learning. So I know that
as you mentioned, Shibu, that there are no any expert doctors available at many areas in our country, and they are not approachable even, but AI might solve this problem, because if the X-rays are taken at periphery, the person who is expert like a tertiary care institute and who is expert in reading pediatric tuberculosis, radiologist, can read that at some other center, and then the reports can be sent within few minutes, seconds even.
Absolutely, because AI driven tool in conjunction with e-Sanjeevani or telemedicine, I think can redefine the diagnosis part. So I think that is something which I'm also very optimistic. So coming back to the prevent, so one of the critical thing is when we talk about children, it's a prevention of the illness, right? And we know that the preventive treatment
is always better than cure.
Always like. So in the adoption of a pediatric TB preventive treatment is also not that encouraging globally, and that too is true in India. So what are your thoughts as a pediatrician? You see kids only, you see children day in and day out. So how do you kind of convince a parent to kind of put the kid on a pediatric TB preventive treatment?
See, first and foremost thing, immunization. I'm not saying 100%, but BCG is definitely helpful. So coverage of the immunization. BCG, Government of India now had done compulsion that BCG, OPV and hepatitis B should be given before discharge of the baby and within 24 hours, because in many government places, if it is normal, baby is normal, mother had delivered normally, discharge early. So that is one of the aspects which is taken. But what I feel that means as a community we have to do a lot of learning and do a lot of changes at multiple places, like accepting that the tuberculosis can occur to anyone in our country. Anybody can be affected.
Besides that, any diagnostic innovations or any futuristic thing which you are part of it, are you aware about anything?
Yeah, actually, we are a part of two research project, I can say. One is about shortening the regimen for tuberculosis. Another is for MDR tuberculosis, and we are associated with one company for AI based chest diagnosis for the chest X-rays. So we are contributing our small part in that. So hope so that it will be useful for the community in future years, recent years.
Yeah. So folks, you have heard about pediatric TB challenges and the solutions for it. We have had a wonderful session, which is very enlightening and enriching our knowledge, and very optimistic in that sense, because when we talk to pediatricians, they always see sick kids, and then that pessimism always get reflected. But Dr. Mane, on the other side, she is actually very optimistic about the advancements happened in science, including artificial intelligence, and she is very hopeful about that these kind of advances in science will certainly help in pediatric TB diagnosis also. And besides that, she's also part of very many researchers which helps in shortening the TB regimen, including some of the AI diagnostic tool. Thank you so much, madam, to spend time with us and also sharing your experiences. And I think we can stop TB together.
Thank you, Shibu, and thank you, Qure, for this opportunity to share my thoughts with you all. Thank you.
Yeah. So TB harega, desh jeetega.
Yes, definitely. TB harega, desh jeetega, and we all will do our best to do that.